This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945. Hey everyone, welcome back to the Outcomes Rocket Insight Series live here at HFMA in Denver, Colorado. I'm here with the outstanding Pedram Afshar. He's the founder and CEO of Escher. Welcome to the podcast.
Well, thank you very much. Thanks for having me.
Yeah, hey look, you're a super interesting guy. You were just kind of getting to know each other here before the interview. And I think this is such a great and interesting story about why you started Escher and why it's called Escher.
Yeah, so I was a physician. I'm a child of immigrants, did a lot of school, and went to medical school and actually have a PhD in computer science. And so one of the patients I was taking care of nearly a decade ago now came in with advanced prostate cancer, which was completely treatable. And he just needed care very quickly, and he wasn't on insurance. So I walked him down to the financial office, and I was just shocked at the difficulty of navigating the process of enrollment in these sorts of programs. And so the patient sadly passed away before he can get the appropriate treatment. That really left a strong impact on me. I decided to quit what I was doing and help start the company. At the time, since I had some coding skills, I did it myself. Nice. So I started, coding up ways to handle workflows, and the very first version was on Google Sheets, and I called patients myself. It was tough going because the hospital I worked with only allowed me to be in the hospital from midnight to 3 a.m. They had a vendor doing the work. Okay. And I said, I bet you I can do better. And they said, well, we don't believe you. So just go. You can have midnight to 3 a.m. And if you can do better, great. And it turns out I doubled the performance of this particular vendor. So that's the kind of beginning of the company. Escher came about because one of my favorite artists is MC Escher. And he designs these lithographs, these types of drawings that have no gaps and no overlaps. And they're called tessellations. And so I just love that idea. The idea of, can we design a health system that has no gaps and no overlaps, is efficient and yet covers everyone. And so that's how Escher was born.
I love it. No, it's such a great story. I mean, look, MD, PhD, like Renaissance man, and wanting to help the people. Like, come on, guys. It doesn't get any better than that.
Thank you.
So we're here at the conference, the national conference, HFMA. What insight would you share with our listeners and viewers that couldn't make it that you feel like they need to know?
Well, I mean, the talk of the conference, it's AI. Everyone has been repeating AI, AI, AI. And I think we've gotten to the point where, look, no one knows really what we're talking about anymore. There's just so many applications of AI. Everyone believes in its future, but no one knows quite where it's going to fit. And I think one of the insights I've gotten in these conferences is that things will be able to move proactive rather than a lot of this financial interactions being reactive to an account being generated. Now we can do things proactively because it's so cheap. With ChatGPT and all the related tools that everyone knows, the cost per calculations dropped to pennies. Mm-hmm. And healthcare is $1 trillion business, and these tools can be operated on pennies per transaction. And that's really where the opportunity is. How do we take these tools and make them upstream? And I think anyone who's in any aspect of the revenue cycle, whether it's denials, prior auth, where we are in Medicaid enrollment, will start to feel like moving things upstream is the way to make the business move forward.
That's great. No, I really appreciate that. It is more affordable, it's accessible. And here at this conference, HFMA, we're looking at the administrative, right?
That's right.
And I feel like adoption is highest inside of the administrative zone. When you get into the clinical care delivery zone, the waters get choppy.
Yeah, and fair to say.
Yeah, right? And so let's dive into the Medicaid space. What are some insights? I know it's a big topic of discussion with the Trump administration.
Right.
The cuts, hospitals and health systems are worried. Navigating all that, talk to us about your thoughts there, since it is your space.
Yeah.
And then maybe tell us a little bit more about how you guys are providing solutions.
Right. So what's fascinating I have friends, I live in California, so I have friends mainly on the left, but I also have friends on the right. And what you hear is that my friends on the right are like, great, let's get rid of fraud, waste, and abuse. And my friends on the left say, well, you know what, we're going to just hurt our safety net and patients are going to lose coverage and hospitals are going to go bankrupt. And so what I've seen in the Medicaid space in particular is that the way these cuts are happening is by increasing the administrative overhead. And that's where technology can help cut all the red tape. What I mean is instead of checking once a year, the new policy requires checking for Medicaid eligibility twice a year. Instead of having a 90-day eligibility window, they're reducing it to 30 days. Now to get on Medicaid, you have to have proof of work requirements or volunteer time. And all of these things are going to create more paperwork and more administrative overhead. And that's where really the opportunity is, in my view. Whether you are on the left or on the right, we can all agree that we don't want to spend money on administrative inefficiency. And patients need faster, easier, cheaper access when they're eligible, no matter what the policy says. And so that's what we are building. We're building tools that help just cut the red tape and the inefficiencies and give patients a true self-service lane so they could enroll themselves faster and easier. And staff, the financial office staff, can operate more productively and have less burnout because they're able to focus on why they're in the business, helping people and not typing data into portals or filling out spreadsheets by hand.
So that's really interesting. And I'd love to really put our hiking boots on this one.
Okay.
And to really understand. We're in the Rockies, right?
Yeah.
So how does this all work? Like, talk to me about who your end customer is.
Yeah.
Is it health systems? And then where does the patient come in? Like, really help us get on this trail with you to understand your business.
Well, I love hiking, being in Northern California.
Me too, yeah.
And so
I'm in SoCal,
the
so
analogy is apt. So really, we're on two sides of the transaction. We help patients by providing them a smartphone-based, AI-supported, but human to catch all the edge cases. And it just is able to speak 100 languages, answer all their questions, collect all the supporting documents, and adjudicate all of the work before any human needs to be involved and give that final stamp of approval. And so we're taking out 90% of the human labor for 90% of the applicants. And that's really the goal. You're never going to get, just like in a grocery store, you're never going to get everyone to use the self-checkout lane. That's just not even a reasonable goal. But if by putting a self-checkout lane in, a lot of people learn to use it and it makes the whole store more efficient. It's an efficiency tool. And so from the patient side, you can access on your smartphone, no app to download. If you're in a hospital, there's a kiosk. You can handle it via kiosk.
So you have kiosks at the hospital?
Exactly.
Okay.
Kiosks at the hospital, smartphone at home, and all the staff have their iPads, which are all integrated together into a common platform.
So then health systems are your customer?
Yeah, so we have payers and health systems.
Oh, okay, both.
So
Got it,
payers
got
are
it.
interested in having another member. They're interested in and they have a thing they care about called churn. So they also care a lot about keeping patients, or they call them members on Medicaid. But health systems are our primary customer, FQHCs as well. These are the federally qualified health centers that really, they're operating on razor thin margins. And any tool that's able to make their staff more productive and efficient while helping their bottom line is totally welcome.
Yeah, because the big problem for them is the revenue to serve these people.
Yeah, so It's this cost to collect that everyone worries about. For every dollar that we collect in our institution, how much do we spend? And when human labor becomes a critical factor, it's just expensive, and it's getting more so. And not only is it getting expensive from a per hour wage perspective, but the staff are burning out. So you have a lot of turnover, and the staff feel like their job is too much pressure. And so having tools augment that to help the staff be more fulfilled at work and also help the patients at home is really kind of the way that we get out of this problem.
No, that's awesome. Really appreciate you outlining sort of the different players, the patients, you got the providers, and then you have the payers, all of which can take advantage of this digital solution, but maybe physical solution. If you're in the health system, the screen's there that you could kind of get what you need. Look, I really appreciate you jumping on today with us, Pedram. It's insightful what you do. You continue to sort of follow your North Star since that first day, that patient that you told us about. What closing thought would you leave our viewers and listeners with as we close today? And where can they reach out to you and your team if they want to learn more?
Yeah, I think the closing thoughts are we are in a place in healthcare where we need to have more openness to giving things a try. And to setting that up, we all know where the future is headed. It's a lot of financial pressure, and I think there's even more openness in taking a shot. You know, the HFMA's, their tagline is lead now. I don't know if you went to that talk.
Lead now.
And I think that really resonates with me. I mean, it's time for folks to say, let's just try it. If it doesn't work, we'll pivot out of it, but we need to try it. I leave them with that. It's worth doing. It's a worthy cause and it's worth doing. To reach out to me, Pedram is Pedram at Escher Health, ESCHER health.com.
Awesome.
Reach out to me.
No.
Thank you so much for the opportunity, and it's great meeting you and talking to you.
Yeah, likewise, Pedram. And for everybody out there that couldn't be here, you have the insights straight to your inbox, straight to your social media feed with the Outcomes Rocket. Make sure you click there and check out the show notes, because we'll put in Pedram's LinkedIn, his email, and his website so you guys can get in touch and learn more. Thank you all for tuning in. And Pedram, thanks for being with us.
Hey, thank you so much.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.